Welcome to my world, another day, another time, another period from knowledge acquisition. Knowledge is power, health is wealth. Today's topic has to do with tonsillitis and eating problem. When we talk of litis, it is already known that we are talking about infection and inflammation, any of the two or both. And when we talk of eating problem, it is common knowledge that having a problem eating, and this is usually associated with tonsillitis, especially in children. So I want to expose us to what happens to the tonsil. The tonsil is one of the organs in the body that fights infection. It's a lymphoid tissue that the body uses to first line combat infection from coming in, and it's located, the tonsil is located at the back of the tongue. But what do we now have? We have a situation where the tonsil is overwhelmed and infection has now made it even become a problem for us swallowing. So what are the complications? What are the issues that makes tonsillitis even these days becoming very early in children? It used to be something that is rare in age 3. So we need to examine this and know what could be happening that is making tonsillitis a problem that is even now happening earlier than age 3. So it's a common problem with children anyway, and adults could have it too. But like I have always said, stay on. Let's look on into the live session. And if you like my presentation, press the like button. Subscribe as we journey along. The outline, objective, introduction, causes of tonsillitis, complication, laboratory diagnosis, prevention, and recommendations are areas to touch. Objective, to expose the association of tonsillitis with difficulty swallowing solid food, especially in children. The explanation of the deviation from known periods of incidence and the complication of untreated tonsillitis. The introduction. The tonsil is a lymphoid tissue located at the back of the tongue, as shown in that picture. There are two oval-shaped glands opposite each other, containing lymphocytes needed to ward off the infection that may be introduced to the mouth through dirty fingers of children and adults. When tonsillitis occurs, as you've seen, the function of the tonsil as a lymphoid tissue is significantly impaired due to inflammation, the swelling, causing them to become less effective at trapping and filtering out bacteria and viruses. The tonsil become overwhelmed and inflamed, making swallowing a very painful experience. The most common cause of bacterial infection in tonsil is Streptococcus pyogenes, group A strep or strep throat, and viruses that have predilection for the upper respiratory tract. When the child experiences tonsillitis, you can see the baby not wanting to eat except you pass in liquid fluid, and that is most of the time the reason for you to visit the clinician. The many researchers' findings attribute infection of the respiratory tract and gastrointestinal tract in children to contaminated hands. That's research work. At times you find children even having to put on the maintain, but that does not in any way stop the child from putting that towel or the maintain in the mouth, sucking it and what have you. Transmission through fecal oral route was found to be common in children who fail to wash their hands and with soap and water. That is even as they grow older, the common experience. The maternal antibody protection of babies for the first 6 to 12 months of age is responsible for the protection children enjoy that makes tonsillitis rare in the first 6 months. When the protection starts dwindling, that's 6 months, the baby is almost perfectly, and that's why the recommendation for breastfeeding is very apt. I have seen babies experience it from 10 to 11 months, which may be related to how active the babies are, especially crawling all over dirty surfaces in the population. Maybe in developed countries, it may start from 3, but in areas where the environment, the sanitations and the hygienes are not helped. That is the experience. Causes. The commonest cause of tonsillitis is strep pyogenes, and that is where we shall dwell on. Also known as Lancefield Group A beta hemolytic strep. You can see it in that diagram. Strep means cocci, that is, they are circular, and in chain you can see them black thread, something looking circular, and you have them joined together, about 6 or more attached to each other, and possessing the M protein that is shown also in the diagram below. You can see the M protein that acts as the primary antigen and determinant of type-specific immunity. M is essential for virulence, providing antiphagocytic function, critical to survival in human tissues and fluid. Strains of group A streptococci lacking M protein are avirulent. Pyogenes is highly adapted to spread through tissues because they have extracellular enzymes that liquefy tissue component and remove them from any confined area of inflammation. Viruses. Herpes simplex virus has also been incriminated, including adenovirus, but at least 70% of tonsillitis are caused by Streptococcus pyogenes. The inflammation usually extends to the adenoids and the lingual tonsil, as shown in this diagram, which you are right to call it pharyngitis, especially in adult, or when you call it sore throat. Complications. 1. Untreated streptococcal sore throat can lead to peritonsillar abscesses, but this is not uncommon. When you look at the area label, you can see the tonsil is the one containing the white spot. That's the peritoneal tonsillar abscesses. The second most dangerous complication of untreated is strep pyogenes may spread locally to give otitis media, where it affects the eardrum, and sinusitis, where you have serious running nose and mucus coming out regularly. The third complication is certain strain of strep pyogenes produce an erythrogenic toxin, and you now have this experience of scarlet fever. The tongue, you have that fall. Later on, it will remove, and you now have a strawberry tongue. Yeah, this one is rheumatic fever, very dangerous, that can lead to myocarditis or pericarditis because the cells of the body has been now sensitized to produce antibody against itself because of the similarity. So you now find a situation where the body itself would attack some of the heart forming nodules, have the heart cells and the muscles and form nodules, and it could also cause streptococcal antibodies reacting with the neurons. When we talk of neurons, we are talking of the cell of the brain. The rheumatic heart disease. These are all serious complications of this strep pyogenes. It's also dangerous because antistreptolysin titer is what you get, and it is based on the streptococcal pyogenes M type, the virulent type. So the valves are affected, and when you talk about the valves are that which allows blood to flow to the other side, but it blocks it. It does not allow blood to flow in the wrong direction. So you can imagine when that becomes a problem, a serious heart problem. This one is a very serious one too. Acute glomerulonephritis. Antibodies to streptococcal components combine with these components to form circulating immune complexes, which will cascade the complements. The complement is involved in the hemolysis, so you can then see blood coming out. It's a damage of the nephrons, and edema will come, hypertension. So they could also raise the ASO titer, and these are all limited to some M types of strep pyogenes. So it is not all infection tonsillitis that will really cause these complications as I've been mentioning. it is some of those who have this M type of this strep pyogenes that will really cause this dangerous one. But if we are lucky, the gene is probably prone against it, then we may be lucky as well. Laboratory diagnosis. The clinician will always be able to check and know the kind of inflammation and also recommend drugs. But if it has to go through the lab because of this antimicrobial resistance fear, a throat swab may be taken to test for strep. A complete blood cell count will also help to disprove whether it is bacterial or viral infection, because the reactions that will be found will really show the kind of organisms that could be responsible for the inflammation. Finally, to the recommendation, tonsillitis is impossible to prevent if there is no improvement in sanitation and hygiene, because regardless of what we want, children will always crawl before walking. And if the environment is clean and one washes their hand with soap and water, it may reduce the rate of infection, especially if the immunity of the child is boosted with breast milk, micronutrients, and fruits. Tonsillectomy may be recommended if the child experiences it about 5 times in 2 years, to avoid the complications that we have just listed. The complication is not generally true for all children. Like I said, at least if the very, very virulent strep pyogenes carrying the M type M protein may really extend to serious heart complications, kidney, glomerulonephritis, and the rest that we mentioned. We must advise children and even adults to keep their hands away from their eyes, nose, and mouth, because it is one way germs enter the body and cause infections. Other hands carry on average 3,200 different germs belonging to more than 150 species, of which some can be harmful and cause infection. That's reference Pfizer.com. It is also advisable to build the child's immunity with vaccination as at when due, in order to boost the immune status of the child. The adult too, one has experienced, like one of my prof during my immunological class, Professor Taffen, would advise that one could be using to prevent all these immunological autoimmune bodies, inflammations and what have you. One could be using prophylaxis, the antibiotic, but with the fear of antimicrobial resistance. Yeah, but one should try as much as possible not to allow any problem, inflammation, infection to stay for too long. That should be my main concern. You have many more videos on this channel, so please watch and subscribe. Thank you.